Good morning, Illini. Welcome back to Healthy Illini Podcast. I am your host, Matt Schrock, as always, and we are at the end of the semester, and finals are looming, finals are happening. People are getting ready to either travel home for break or travel somewhere else for break, or maybe just hang out and just relax for break. But we want to have a conversation about exercise and health, because these are important no matter what time of year it is. So it's an important conversation. There's some exciting things happening on campus, and I'm ready to jump into that conversation. Today, I'm joined by two guests here from our campus family. First up, we have Dr. Emerson Sebastio. He is an assistant professor in the Department of Kinesiology and Community Health. He is also on the Committee for Exercises Medicine on campus, and we'll talk more about that in the episode. But Dr. Sebastio, thank you for being here.
Thank you so much for having me.
And our second guest is Emmett Yale. He works with Campus Rec here on campus at UIUC, and he is a program assistant for personal training. Emmett, thanks for joining us.
Absolutely. Thank you.
So one aspect of Healthy Illini that we try and highlight is just a lot of the different areas of wellness, and especially when those areas interact or cross over, because on all of our lives, we have things that we would do siloing, where it's like we do this one thing and then we do this one thing, but that's really rare for our lives. Actually, everything influences everything else. And that's the same way when we're talking about wellness. And so if I say medicine, a lot of times our minds immediately go to doctors and pills and treatments. If I say exercise, we don't connect that to medicine. If I do say exercise as part of a doctor, we think of rehab, or we think of, coming back from an injury or back from an illness. But that's not really what we're talking about today. What we're talking about is an initiative that's happening on this campus and other campuses too, that really is pushing to influence and highlight that crossover between exercise and general health and medicine. And the initiative is called Exercise is Medicine on Campus. Again, that's Exercise is Medicine on Campus. So let's just start with a general overview. And Dr. Sebastio, I'm going to start with you because you're on that committee. Can you kind of tell us just in a very general idea, what is this committee that is a part of Exercise is Medicine on campus?
Yeah, absolutely. This committee is charged to try to promote physical activity on campus. And this is part of a bigger initiative called out back in 2007 by the American College of Sports Medicine with the American Medical Association to try to promote physical activity as a vital sign, as a standard in clinical care. And this is just a branch to bring that idea to campus, since we have a large amount of students and most likely, physicians on campus are going to be seeing a lot of people that are in need to be physically active. And so what we are trying to do is to connect the health campus or the health section of campus with the rec center and other units on campus to try to really promote physical activity, as we know the benefits that physical activity can have both for physical and mental.
And it's not just our campus professionals here, but the committee itself has more than just campus leaders. Is that correct?
Yes, that's correct. So what we try to do is to make it easy for people to really understand and to get moving, get going. So that's why we also need the community involvement to that.
And just to kind of highlight the importance of this, there is not just like campus rec leadership, I shouldn't say just, but campus rec leadership and like McKinley leadership, but the highest levels of leadership here on campus are behind this, including Chancellor Jones. And he actually made a proclamation, if you want to share just a little bit about that.
Yeah, absolutely. The campus has been very active in this idea of exercises medicine on campus. And we are lucky enough to have, a high leadership on campus buy into this and knowing the importance of this. So Chancellor Jones signed a proclamation saying that October is the month for exercises medicine on campus. So this is huge, as validates all the good things that we are doing related to, healthy lifestyle, including physical.
So let's talk a little bit about those things, because we can talk about, there's a proclamation, there's a committee, it's a wonderful initiative. But if I don't talk about what it is, it really doesn't mean anything to anybody. There are four main goals that are in this Exercises Medicine. So let's break down each of these core goals, and then just kind of talk a little bit about, from each of your areas, how this is affecting what you're doing and how you're trying to promote it on campus. The first goal is the goal of just making movement a part of daily campus culture. What does that mean? How do you influence that, or trying to influence that here on campus?
Making movement a daily campus culture essentially just states that exercise and movement should be implemented in as many different components of our lives as we possibly can, whether that is as from a student's perspective, during studying, during socializing with other friends, and from a professional perspective, during meetings. Perhaps instead of having a meeting in a closed environment in an office, perhaps you are having a meeting outside while you walk in, or implementing it within a yoga session or something that follows that line. For instance, we have pop-up classes and yoga classes as of today. We have one at Beckman Institute. We hold those weekly, if not every 2 weeks, where you pop up to these different facilities, Beckman Institution. We have had one outside in the quad when the weather was a little bit better. And it's just a great way to get people moving in a sense of, let's say they're at the union, for instance, they walk outside and they see a yoga class on the quad. They are free to join as they please. And it's just a great way to just implement movement in social, making movement social, basically.
And I love the fact that this goal says making movement a part of daily as opposed to making exercise, because exercise can be a scary word for some people. It can be daunting. Am I doing it right? I had a bad experience. I don't feel healthy. I don't want to be looked at. There's a lot of reasons why, and most of those are in our own head. They're not really things other people think of, but it can be daunting. Whereas movement, that can mean a lot of things, big and small, and so that's a big part of this goal. I like that aspect of it of it's talking about movement specifically. The second goal, and this one I know, Dr. Sebastian, you've been really involved in this part of it. The second goal is to assess physical activity at every student health visit. This is where the crossover really happens, because when I think of when it's activity and exercise, I think of campus rec. When I think of getting a health check, I think of McKinley, but I don't often think of the two tying together directly. Like, sure, they kind of influence, we talk about that, but the direct tie there. And so how is this committee trying to implement this idea that this goal is important to assess physical activity at every student health visit?
This is part of the main idea or the global initiative of having physical activity as part of the standard assessment in clinical care. What we are trying to do is that, similar to, because we know that physical activity is so good for health, there's an overwhelming evidence out there, scientific evidence out there. We don't have a lot of people that take advantage of that. So think about our campus, for example. We're about 55,000 students, and we have some data showing that, about 30 to 35 use the rec center, the facilities, to be physically active. So where's the rest? But we do know that they visit McKinley, right? So we're trying to leverage on that. And because we know of the importance, use the structure that McKinley has to not only advocate, but to promote physical activity among those students. One thing that we do know science-wise is that doctors have a powerful voice. They are more likely to listen to the medical doctors, nurses, nurse practitioners in this environment if they tell them to be more physically active than, unfortunately, like an exercise specialist. But that's what we need. We need to both to work together, so can say, okay, you come here, McKinley visit, your physician, your nurse practitioner, and they're going to evaluate your physical activity. And based on that, they're going to tell you whether or not, or the resources that you have, and if you should be more physically active or not. So this is what we're trying to get as to leverage on the powerful voice that health professionals have in this environment here to help people engage in more physical.
If you look at the website, and this will be in the resources, so you want the website, it's in the bio. But if you look at the website, you look at the 4 goals, you're going to see we're going to skip ahead to the 4th goal because it directly ties to that one. And I want to follow up with that because the second goal was assessing physical activity at every student health visit. The 4th goal listed is to connect university healthcare providers with university health fitness specialists to provide a referral system for exercise prescriptions. That's a lot of words. But what you're talking about is this idea of having providers, medical providers, doctors, practitioners, whatever you have, being that voice. But how does that connect then? Because they can share it, but how are the medical professionals and the fitness specialists, how are they connecting with each other to help support one another? What's happening in that realm on campus?
So it's going to happen through a referral. Something that we are implementing right now. Right now, we're doing what we call an intake, just assessing the physical activity level, whether or not they meet particular guidelines. We want to go a little bit further. As you mentioned before, exercise can be a big word for some. They might be afraid a little bit. So we're really trying to help with that part and kind of bridge the gap between, okay, so you maybe don't know what to do, but we have a lot of people on campus that can help you with that. So what we want is that, the healthcare provider to send this student to us. And then we have a lot of a structure to help that student to build physical activity into their daily.
And then that connection just is a big support. It's just a bigger support for students and helping them. And I talk about it on this program a lot, that we're on this campus, people who work on this campus, we care about our students. We do, and we want to help. We want to be involved. And the things we're passionate about, we want to help them see the benefits of. And so this is a great way to connect the medical and the fitness sides together, because they're not that distantly related. They're very closely, but we don't think about it that way. And that's kind of the whole purpose of this initiative is to tie them together. So those are the three that we've talked about. There's a fourth one, and this one, I know, Emmett, this really falls in your wheelhouse a lot. The fourth goal is that we want to provide students with the tools necessary to strengthen healthy physical activity habits that can last a lifetime, the things that they can carry on with them. That's obviously what Campus Rec has been doing, but in what ways has there been an increased emphasis in that area in the things that you're doing and trying to implement this last goal into everything that every student you come in contact with?
Absolutely. Just as Dr. Emerson was speaking about, this network, this idea of connecting medical professionals with the fitness field and fitness specialists, here at Campus Recreation, providing many services to help students become healthier, practice these skills and utilize these tools that are available to them, in the sense of we have services such as personal training, we have group fitness, we have wellness field, which is all based on the mental aspect. How do you deal with the pressures of college life, basically? And a big project that I've personally worked on this past year is called Illini Jumpstart, and is essentially just a startup for beginners to enter the gym. They come in, they see the gym. It's an intimidating place, especially with the renovations we've done. It is a huge place. You don't know where to start, which floor to start on, all the above. How do you utilize a certain machine, exercise, and exactly what do you follow, And in that sense, Illini Jumpstart gives you a guide and a tutorial to how to utilize everything, how to go about starting your own workout programs, how to go about beginning in a gym, essentially. It'll give you referrals to speak to personal trainers that we have available, as well as other students around who are willing to just help you out, give you guys in terms of setting up your own goals, give you guys in terms of starting up conversations in the gym and making the gym, again, a social and a cultural space for everybody. So in that sense, that's one huge thing that we've strived at Campus Recreation. And in that, we've seen an increase in students coming in, whether that's from facility improvement or better promotion, as well as integration into different fields such as the medical field, all the above. Just more students are coming in, and we want to keep seeing that number go up and rise up. And a huge thing about Campus Recreation that we've seen an improvement in is group fitness classes. And I want to bring that up because group fitness class is a great place to meet other students. It's a great place to create that community feel. You go to the same class every day, or you try out other classes, and you'll start to see similar faces. They start to feel less intimidating. You start to build connections, and you want to come back, You want to explore other things. You want to take it on your own, challenge yourself, and build and grow upon what you've already started. So those are some of the tools that we provide here at Campus Recreation in terms of making health a culture,
I love two aspects of what you said there. One is that you make it your own, and we talk about it on this program a lot. Everybody's on their own journey. And so it is important to have an individual plan for whatever you're doing. But I also liked you talked about the group fitness, and you talked about having a familiar face and a familiar place. Because really, when you walk into something intimidating, and the art can be intimidating, I mean, as a freshman coming in, you've never been in the place. You may have been, like, for my instance, for my high school, the arc is bigger than my school, let alone the weight room or anything. It was bigger than the entire school. So that's intimidating to walk into. But if I can break it down and find this familiarity here in this group or in this area, and I'm not dealing with the whole massive building at once, I'm dealing with this little bit that I can be comfortable in this spot. I can find my place in this spot and then branch out from there. That's a great place to start.
And following up on that, a great thing you guys discussed a little earlier was that individuals and students are more likely to listen to medical professionals. But there is one thing above all that they will take priority in, and that's their peers. Students will listen most to their students. If they're to their peers, they walk into a gym environment and they see somebody that they recognize, somebody they can trust, somebody they can relate to, big smiles, and instantly you get that connection. Instantly you go and you are able to comfortably integrate yourself in that environment. And you have somebody there to not only hold you accountable, but to also support you and motivate you to just come back and push yourself and integrate it outside, you know? So there's different ways, and you can tie that into many different aspects. You need somebody for something outside of the gym that relates to your health. You follow up to that same exact individual.
I love you said peers. I'm going to take it a different direction because we're talking about student peers here.
Yes.
But with this initiative, it's not just UIUC that is doing this. It's other campuses. So our peers. But there's a friendly competition among these campuses. And that basically it's a way to show how we're promoting, how everybody's elevating physical activity on their campuses and kind of thing. But there's been a competition, and we recently involved ourselves in that with a mascot video. So, Dr. Special, would you talk about that a little bit, about how that competition is structured, how we're approaching it, and some of the benefits that we've gotten from that?
That's a very fun part of the work, along with many others. But they try to promote a little bit more and try to get to know what people are doing out there to spark new ideas and think along those lines. But it's a mascot competition for the exercises medicine on campus. So every single institution, university out there, they develop their own mascot. And we are lucky enough to have Dr. Alana Harris with us, who is really passionate about always developing those scripts. And this is not the first time that we participate, but I believe this is the first time that we brought that home as the first place for the video that her and her other people from the community and students in kinesiology put together.
And
Campus Rex.
It was Campus Rex in conjunction with McKinley's Buddy. But it was a conjunction between Buddy and Rex. And it was a really cool video. We actually had him go over to the ARC. And if a student was in that day, they saw this two giant mascots on the treadmill walking around. We got some looks. But it was a lot of fun to make that video. And you're right, the UIUC got first place. And that's a big deal.
Yeah.
That's a big deal because there's a lot of campuses involved in this. And it not only shows the creativity we have on campus, but also the passion that we have on campus, because you don't make something that wins without some passion behind it. So that was really exciting to see. Okay, we're almost out of time. So before we end, I want you both to kind of give some tips. If someone's listening, if they're listening to this episode and they're like, you know what, I want to get involved in this initiative. I need to support it. I want to implement it in my own life. What are ways they can do that? Who can they talk to? How do they find out more information? What steps can they take to make this initiative part of their own lives?
To get a head start, first, you have to put yourself in positions to get exposed to the information. Look around. Come to campus recreation, the ARC, all our different facilities. Walk in the environment with a positive attitude, and anybody is going to be willing to help you out. Look online. We have our campus recreation website that links you right to this initiative right here, as well as different resources such as Illinois app that'll lead you exactly where you need to be. If you want to see what type of events we're holding, you go online and you can see that as well. Walk around to the to the quad. We have events out there every so often. For instance, in October, which was Exercise is Medicine month, we held a jump rope event on the quad. We were out there for 2 hours. Students came in, they did a little movement, some push-ups, some squats, some drop ropes, and they were able to win some prizes. And we have those pop-up events every so often. So do not be afraid to reach out to the Campus Recreation website, any links, emails that are out there. As well as speak to your peers. You never know who you're going to encounter who has been involved with this, and they can be a great resource and a great reference for you to get in touch with exercise medicine.
Yeah, Emmett touched in a very important point here. October is the Exercises Medicine on Campus month, so we have a lot of events, and most of the times we're in need for volunteers if you wanted to get your feet wet. Hell, for example, we also hold the 5K run. So we need people to help with the stations. And other than that, we are more than happy to listen to people's ideas. We don't know everything. We are here to help. And what we want is to help students, to help our community. And then if our students, our community have any good ideas, more than happy to listen to you. Can send us an email. You can find some information on the website, especially in the exercises medicine component of that. please email us. We would love to hear from you if you have a new idea. And that's it. Try to stay there, be active as much as you can, start the way you can. But if you need help, just come ask.
I really appreciate you both taking the time to talk about this today. It's a huge initiative. It's really important. And it's something that people may not have been aware of. And hopefully we can bring some light to that to some of these students. So thank you so much for joining me. I really appreciate it today.
Thanks for having me.
Thank you for having me. Absolutely.
Incorporating movement, incorporating exercise as is medicine in your life is something that's really not that hard to do. The first step can be hard sometimes because you just don't know where to start. You just don't know what to involve yourself in. You're not sure what the options are. And so please check out the bio today. Look at the links we have, email, call, reach out, whether it be any of those links are here at Healthy Illini, here at McKinley. Contact us. We want to help. We want to be a part of your journey here while you're on campus. We want to help you be the best you can be. And so if there's any kind of advice, any kind of direction we can give, we want to do that. And again, there's so much of our lives that bump into other things, and we want to be a part of that crossover between medicine and exercise and everything in between. And we just want to come alongside with you in that journey. But thank you for joining us today. You are on a personal journey, no matter where you are in it. You are important and you matter. Your health and wellness are important and matter, and we are here to keep you well to excel. So go have a great week, Illini. Let us know how you're doing, and we'll catch you next time on Healthy Illini.